It's likely that the Health Insurance Portability and Accountability Act, or HIPAA, has already caused a number of changes in your own practice. In fact, you might even be experiencing a little HIPAA fatigue because of all the changes. The HIPAA Act was the beginning step of an important reform of the American healthcare system, and it is important to understand the provisions of the HIPAA law, the underlying rationale that brought these changes about, and how the law affects resident privacy and data security in the field of long-term care. With the number of Americans changing jobs, many employees were abruptly finding themselves covered by a new and different health care plan, often requiring them to choose new providers and transport their records to a new facility. Congress wanted to address the issue of portability, protecting health care coverage for employees who change jobs and allowing them to carry their existing plans with them to new jobs. But given the great variety of plans in place, including HMOs, PPOs, and indemnity claims plans, it was simply not practical to require immediate portability of the exact same health insurance plan. In terms of full portability, Congress decided on a course of incremental health care reform. This reform affected all facilities, including long-term care. As its first incremental step, Congress passed the HIPAA Act of 1996, which was further defined and modified in subsequent years. First, we will look at an overview of the different titles within this act. Later, we will look more closely at two of the rules within HIPAA that have the most impact on healthcare practice. Title I of HIPAA covers healthcare access, portability, and renewability. As mentioned earlier, because of the great variety of health plans in existence, guaranteeing full portability was not immediately practical. Title I of HIPAA did not break new ground on these questions. Essentially, it restated federal laws and protections that already existed. Title I promotes renewability of coverage by prohibiting employee health plans from denying coverage to new employees based on health status, medical history, genetic information, or disability. Title Administrative Simplification, however, contains 5 separate rules, most of which have already had a significant impact on virtually everyone working in American healthcare, including all those working in any way with health information concerning residents. First is the privacy rule, which is meant to guard the confidentiality of all protected health information. This is defined as any information that includes the resident's name or other identifiers, such as a birth date or a medical record number. Protected health information can be data that is written, spoken, or in electronic form. The privacy rule came about because many healthcare workers have been far too willing to talk casually about their residents without thinking how this violates their confidentiality. We will discuss the privacy rule in greater detail later in this program. Second is the Transactions and Code Sets rule. To lay the groundwork for portability, this rule sets standardized codes and formats for the interchange of medical data and for administrative purposes. HIPAA mandates 2 types of codes for the transfer of data. First and most important, uniform codes are needed to describe diseases and injuries, describe the causes of the diseases and injuries, and to describe the preventions and treatments used.